Hi, my name is Ty Mindenhall. I'm a faculty member here at the University of Minnesota Medical School in the Department of Family Medicine and Community Health. And as part of my job description, I direct the mental health teams in our Medical Reserve Corps through our Academic Health Center. Today I'm going to talk, as you can see there, about building communities or building, building community resilience to disasters. And I think that that's an important part of resilience that we oftentimes miss. As you can see, we have a lot of different definitions as it relates to resilience, and most of the time we associate them with some type of innate strength and some type of individual level focus. The ability certainly to overcome challenges, to bounce back, to get through adversity. But when we really look at resilience, it's not just an individual thing, and it's more than this innate or inborn strength. A lot of times, in fact, it's just the opposite. One of the things that we do in mental health as we talk about resiliency is look at, for example, the parallel of sobriety with drug addiction or alcoholism. The concept of being dry, while on one hand might be kind of good because you're not abusing alcohol, is a wonderful metaphor, because anytime that there's stress placed on something that's dry, like a dry twig, it's going to snap. Sobriety is more about being able to bend, and so is resiliency. People that are resilient absolutely experience pain. They absolutely can go through very difficult tragedies, difficult struggles with mental health, physical health, a variety of things like this. But that doesn't mean that they're weak. It means that they're going through this process that we call resiliency, ultimately up to and leading to some type of recovery, however that's defined. It's interactive across different systems, across the individual system, across the family, and it really does apply, or we can see it being applied just about everywhere we look, from an acute trauma on a small scale to mental illness, to chronic illness, to large-scale stuff. Okay? But most of the time, again, when we think about it, most talks that you would go to or most books that you would read about resilience don't recognize the systemic complexity that resilience oftentimes brings. When we look at biopsychosocial complexities of people, and over the last few years even adding spiritual, a lot of literature has done this to call it biopsychosocial spiritual levels of complexity with people, we understand or we start to appreciate how much more these different systems are connected. Anybody who's ever gotten butterflies when they're nervous, or a headache when they're stressed, or like me, get a cold when you're putting a grant proposal through and you're sleep deprived, knows that your mental health and your physical health are always connected to each other. Your brain is always talking to your body, and your body is always influencing your brain. That's one step to understanding the systemic complexity of what this is about, but we also live in the contexts of relationships, in the contexts of families, in the contexts of our social systems broadly defined. And so if we, if we look at the person that we're with 24 hours a day as a starting point, being ourselves and our physical selves, a lot of what is out there that talks about resiliency will start there. That's not where I'm going to spend a lot of my time today, but it is important. We need to follow the sleep hygiene that we talk to our own patients about. We need to follow the diet and the exercise that we talk to our own patients about. And the reason that this is important to at least highlight, one is that in this series, you've probably heard it elsewhere, but people that are in the mental health and the physical health, the biomedical health professions, people that are in the first responding types of professions, and there's a lot that fall under that, oftentimes are notorious for not following their own advice. At the medical school, we see this all the time. We're post-call living on caffeine and candy bars, pushing grants through whatever, and then we turn around and talk to our patients about the importance of a balanced lifestyle, eating a good diet, hydrating a lot, sleep hygiene, and date night. It's important in terms of disaster and trauma response, because oftentimes that baseline level of functioning where we're just able to work without burning out places us into a more dangerous context that's of a higher intensity, where at that point we very well could start to experience the symptoms of burnout, compassion fatigue, everything that would go along with it. As it relates to our psychological functioning, again, that's the person that we're with 24 hours a day, but sets the stage up for what we're going to talk about mostly now. Our own mental health and the perceptions of the ways that, and the perceptions of the stressors that we deal with research has shown again and again is the strongest predictor of how somebody psychologically ultimately will adjust. That's why a lot of the field is pushed towards what's called psychological first aid now. We know from the early models of stress, the ABCX model, the double ABCX model, etc., is that if you have a balance between stressors, however that's defined, vis-a-vis resources, however that's defined, and they could be resources that are there, ready to go, or they could be resources that develop in response. Generally, that balancing act is not as important as the perception that people have of that. That's why two people can experience the same thing and ultimately have very different outcomes in their recovery because of the ways that they perceive and the ways that they process what has happened. In terms of dyadic and family functioning, that's where we start to get more complicated because we, as ourselves, and 24 hours a day, there we are now interacting with others that are also doing this as well. Probably the best way to make this make sense is that if you watch a movie, you watch the hero or the heroine go through the whole story of the movie, and you see them in this scene and you see them in that scene, and you follow them through that experience. That's like our own lives. We are the hero or the heroine, and we're going through and we're there for every scene and every experience. We oftentimes forget that everybody that we interact with is also in their own movie. And so we might have a 10-minute experience with them, and then we go on to our next scene, but they went on to their next scene as well. And so understanding that the world in that regard doesn't revolve around us is one nice part of this, but it's also a way to figure out how we can engage with each other and how we can work parallel or against each other in different trauma and disaster contexts. Certainly the ways that we communicate with each other, the ways that we support or not, the ways that we connect in terms of our own relationships, whether they be defined by love, friendship, etc., are essential in the process of resilience. And ultimately, when a lot of our attention in terms of science and in terms of our own training as it relates to trauma response is focused on the individual, we can miss that. We can miss that complexity. And when we do, we oftentimes miss the very resources that can help people to be resilient. That then connects to the broader context in which these couples and families function. Anybody that's ever dated somebody that their friends and their family don't like know that it's important to have your community and your context rallying around you and rallying around the relationships that you're positioned in. Any immigrant family that might feel disconnected from people that share similar experiences to them or feel dissimilar to the rest of the context around them also knows how important the context in which the relationships are positioned is for your own day-to-day survival, but certainly your survival and your recovery if something disastrous or traumatic happens. So that's what we're going to be focusing on mostly today. And with that, when we start to define resiliency as it relates to social systems, there's a lot of ways and there's a lot of people that are in those ways of defining what a social system is. If you go back to your statistics classes from, freshman year of college or high school, you remember the Venn diagrams that overlap, the circles that are overlapping with each other. So there's all women here, and then there's people in Minnesota, and then when they overlap, it's the women that live in Minnesota. Similarly, as it relates to social systems and communities, there's friends, there's lovers, there's family members, there's colleagues at work, and a lot of times those very same people can fulfill different roles. Friends are important in terms of the shared identity, if you will, that is unique to them. That's why adolescents, for example, oftentimes consider their friends in terms of a second family, and developmentally appropriately so, oftentimes as a family or an identity network, if you will, that's even more important than the biological one for at least some period of time. Support groups are, and they can certainly, again, include friends, and they can include others that you didn't know outside of or before that support group formed, but has an especial and an intentional focus on helping people to recover or to survive something that's painful. Community groups, faith community, school, etc. Here we are at the University of Minnesota. Many of us are very patriotic. We will be patriotic to people that we don't know. We'll be patriotic and feel a sense of community if something happens at the university that's good or bad, that somehow we all share in that. And there's a strength and there's a resource that's difficult to define, but we feel it because we belong to that same group. So our official definitions of community-based resilience echo some of the individual level definitions that are out there. It relates to the capacity to be prepared for a disaster or trauma to happen. It relates to the capacity to respond to or repair. And then it also relates to the capacity to prepare even better after something has happened again. We don't start with a blank slate, hopefully. We have resources built up and ready to go, and that functions through our day-to-day lives as communities. When something happens and we hurt and we're damaged and we recover, we access and tap and hopefully build and expand those resources that we have. And then from there, we learn and we do it even better next time. Hopefully there isn't the next time, but we need to always be prepared for that possibility to happen. Then, as we unpack that, if we go back to the Venn diagram example on the different facets of what community resilience encompasses, most of the work that's out there aligns with these four things: economic development, social capital, information and communication, and community competence. And we're going to go through those in turn. Apologize for being sick. In terms of economic development, one of the things that we look at, and again, this goes across the prepare, the repair, and the prepare even better sequences of what community resilience is about. As it relates to economic development, one of the things that we look at is the fairness of risk and vulnerability to hazards. This is a nice way of saying that people that are of low socioeconomic status oftentimes are at more risk of getting hurt. They're at more risk of being hurt because they tend to live in contexts or environments that are more vulnerable, for example, to natural disasters. The mudslides that happened in Brazil lately are a good example of that. Very wealthy people didn't live in those locations. They lived in much safer locations. It also relates to the ability to mobilize or to connect resources to different geographic areas or to different geographic groups. We know, for example, here in Minneapolis, St. Paul, it doesn't even have to be a disaster and emergency, but last year when we had Snowmageddon and we had, 3 feet of snowfall overnight, it was all the wealthy neighborhoods of Minneapolis that the snowplows go to first. And, even when there isn't a snow emergency, they still go there first. That's just how the community and how the social structures of different towns, different cities oftentimes roll. That can be a huge problem in the contexts of disasters because oftentimes the people that have the least are, again, hurt the most and then are not able to access or to tap resources as quickly as people oftentimes that don't need them as much. The level and then the diversity of economic resources within a community relates to whether or not that community has all of its eggs in a particular basket when a disaster or a trauma or a widespread trauma happens. For example, with Hurricanes Katrina and Rita, there were communities within that larger group whose entire economic well-being depended on the shrimping industry or whose entire economic well-being depended on tourism. And it's like investing all of your money in a particular stock instead of diversifying. And so when the entire shrimping industry was wiped out, so was that entire community's ability to survive financially. And so when we look at a community's ability or preparation, if you will, for a disaster, it's oftentimes important to consider where its resources are and whether or not or how there are particular ways that we can diversify those out so that the community does not have all of its eggs in one basket economically. The equity of resource distribution overlaps both of those things. Certainly in terms of resource distribution after a disaster or a trauma has happened that we were getting at before. I mean, places without as good of roads or infrastructure or even snowplows are a lot more difficult to get resources to. And then, of course, as it relates to the distribution of where the income is coming from, oftentimes the people that are struggling with making ends meet aren't able to mobilize or to pay for or to have the regard for the larger infrastructure of resource distribution to put them on the top of the list. Then, as we go to the next Venn diagram, social capital, and this is related to the people more than it is related to the money, but it's another, again, part of how communities and how community resilience is defined. the enacted social support and then the expected social support relates to the past connecting with the present. In a particular community, however you define it, there's always subgroups. And so, for example, when we had tornadoes come through Minneapolis, there were a variety of churches that joined together and offered a variety of different resources, tangible and social, to people that were affected by those tornadoes. Now, they weren't extending a particular allegiance to the Catholic community or to the Baptist community or to the Lutheran community or to even people that ascribe to those different faiths or churches. They were taking care of each other and offering each other's help, and that experience sometimes was talked about between members of that community or organizational leaders of that community as something that they appreciated very much but almost felt guilty because maybe their community, their church, their neighborhood wasn't heard as much. That connects to the expected social support, where the idea is that different parts of this community are not keeping score with each other, and they understand and they know that if it had been them, or if next time it is them, that the support that they themselves are extending now would reciprocally come back to them then. The social embeddedness and the informal ties connects to the idea, and this also relates to the organizational linkages and cooperation, that the community members and the leaders of the leaders of these organizations, when they themselves can overlap, oftentimes are able to collaborate more in a flat hierarchy with each other than a disconnected or a hierarchical or more rigidly vertical, I guess, hierarchy. Because the leader of the church, for example, is also a community member, because the principal organizer of a particular community organization is also on the PTA. There's a variety of different ways and different places that we can be, and if people have the lived experience and the wisdom of living in the community at the same time that they have the power to mobilize organizations within that community, everybody wins. The citizen participation then gets at, and this is really pushing a larger movement in healthcare outside of disaster contexts as well, and that is that the main untapped resource in healthcare, and certainly in trauma and disaster response, is that knowledge and energy and wisdom of the very people that we're trying to connect with and that we're trying to help. Yes, I went to school for a very long time. I have a lot of letters at the end of my name. I am doctor. Okay? But that doesn't mean that I'm the best person to provide support, and that often doesn't mean that I'm the best person to answer a particular question. The members that are positioned within that community, the people that live in that community, and the people that live with fill in the blank as it relates to something that they've experienced secondary to that trauma are truly the experts. And if we provide care in a way that's top-down and service delivery because we are the leaders of a particular organization or because we're the ones that went to school for a long time, oftentimes we can either miss opportunities to help people, or even worse, we can hurt them because we've missed something that's that essential. The sense of community and the attachment to place circle back to a couple slides ago, where you can feel connected to somebody without even knowing them. You have your University of Minnesota shirt. You know, I love to drive motorcycles, and it's always fun for me how every time two motorcyclists drive by each other, they hold their hand down and wave. We don't do that with cars. We'd probably get some pretty strange looks, but there's this sense of connection with somebody because we share something in common. With our tornadoes that hit Minneapolis, we saw that certainly as it related to the smaller communities defined by the church, but then also in neighborhood ways to say that you go to this church and I go to this church, but we're part of this neighborhood, and there's a variety of ways to demonstrate that. The community capacities towards resilience with information and communication, again with that Venn diagram metaphor that we're continuing throughout here, relates to then the ways that the different parts of a community can connect with and talk with each other. Certainly in preparation, again, for example, already having the infrastructure, because you talked about it ahead of time, on how we set up hotlines. Where are we going to have information places, repositories, if you will, for people if and when something happens. For example, here at the University of Minnesota, we have In the Twin Cities, we have 3 very large campuses. We have 64,000 students if you count the night classes and the day classes and all the different graduate and undergraduate programs. And that's an awful lot of people. It's an enormous place across, again, these 3 different campuses. And across all 3 different campuses, we've already figured out where we're going to have mass dispensing sites, where we're going to have information processing centers, where we're going to set up incident command. And we don't know what the disaster or the trauma would be yet, but when it happens, we already have that set up. And so if or as something happens, then it can very quickly be mobilized into action instead of in that moment trying to figure out what we should have figured out a long time before. As it relates to the narratives then, as people come together in those contexts, even in those town hall contexts, for example, when our 35W bridge collapsed and we had our family assistance centers, that was that represented a safe place that people could go from a variety of different roles connected with either the families of people that were missing, the mental health, the biomedical providers, the public health workers, etc., to share narratives in something that they all had a different piece of, to understand what was going on from their respective viewpoints, and creating this collective identity or this collective experience that in and of itself was very supportive to those that were involved. The media then, as it relates to this, is oftentimes where people find out where to go. And so it's important to work with media and to have established relationships with folks on the front end so the media knows how to respond. And then in the contexts of media, to do and to highlight responsibly different parts of the disaster or the trauma that are truly for the benefit of the larger whole. That can go very well and it can go very poorly. And I've certainly seen both. For example, when the hurricanes happened in New Orleans, there were a number of media outlets that really highlighted and emphasized the looting that was going on. And if you look at the 100 other things that were good that were happening, the media, a lot of the media chose to focus on the single or the comparatively shorter list of what was bad. And ultimately what that did, although it was certainly good news, I mean, if you turn on the 5 o'clock news, the first 15 minutes of it is, you know, how awful everything is, and then they talk about the good things later after people have gotten up and, you know, gone to dinner, etc. Because most people are kind of drawn by listening to the bad things. I mean, in therapy, I talk to my patients all the time that if they heard 100 good things and 1 bad thing, the first thing they would remember tomorrow is likely to be the bad thing. Well, media does that as well. And in New Orleans, that emphasis on the looting did a variety of things to redirect attention by the military and attention by local social services to the looting instead of to the people that were in such desperate need of help and resources. And that was an example about how the media missed the mark. They certainly had people watching them, but for the larger good, I think that they fell short of the folks that were there. Excuse me. The trusted sources of information as it relates to the different contexts and the different places that these disasters happen, generally the local media is a better resource than the national media. And it's important to have the local media collaborate with the national media. Certainly the national media wants to let the rest of the world know for a variety of reasons what's going on, but as it relates to, I am on the West Bank and there is a flu pandemic going on, where is the mass dispensing site? It needs to be coming out of the University of Minnesota's resource lines, hotlines, the Minnesota Daily, those types of resources before it would come out of NBC. And certainly the experience, if you circle back to the membership within a community, the belief in and the trust in local media is going to be higher than it will be to a larger media source that's metaphorically looking at things maybe from the 1,000-foot view. Excuse me 1 second. As it relates then to the community competence, what we're getting at here is a large-scale version of what any healthy couple or family would do as it relates to experiencing and going through something that's very difficult. And interestingly, as it relates to community-level processes, oftentimes this is a tougher call for people to do. Because they have agency names to protect, or because they have a particular investment in their organization certainly being seen in a good or a positive light. And to be clear, everybody has their hearts in the right place, but we don't always get it right. And we need to be humble, and we need to be reflective and collaborative about what worked really well and about what didn't, so that we can then, again, from the earlier definition that we put forth regarding community resilience as a whole, we can prepare even better next time. So what we're getting at here is that after or as disasters happen, we need to be checking in with each other as community members, as community organizations, to notice and to figure out where our overlaps and where our gaps are in services, where we locked horns, where there were some potentially awkward or political turf battles between different organizations, and figure out how to work those out in a better way, certainly in the moment, but absolutely for next time. The 35W Bridge example that comes up in my mind as I'm thinking about this is that there are a variety of organizations here in the Twin Cities that, before the 35W Bridge collapsed, tended to go somewhere else. And when the 35W Bridge collapsed, this was a disaster that happened here. And a lot of the organizations, the Hennepin County Police and the chaplains, the Medical Reserve Corps through the University of Minnesota, Ramsey County, the East Metro, a variety of these organizations that had never worked together before did. And there were some tremendous things about that. And there were also some things where we stepped on each other's toes. And from that experience, we met many times afterwards to better coordinate and to figure out how we can do an even better job when something large-scale like that would happen again locally. And that took some humility. It took some humility to say, yeah, maybe we didn't do that quite right. Or it took some humility to say, you know what, you might be able to do that better than us. Or to say, okay, if and when something happens, this is how we're going to do it differently. This is who's going to be in charge. This is how we're going to organize. Ultimately, because again, we all have our hearts in the right place, and we're after the same goal. Okay, that flexibility, certainly the creativity, can look a lot of different ways. After the 35W Bridge, one of the ways that looked was to synchronize and more streamline, not streamline, make it shorter, but streamline, make it more consistent across the different ways that organizations train their volunteers, so that when one person says incident command, or one person says any of the acronyms, what's an MRC, for example, then everybody knows what everybody else is saying, because a lot of times we were just simply speaking different languages. The collective efficacy and the empowerment that comes out of that is tremendous, because then the different parts of the community start to feel like they're connected to a larger whole instead of competing with each other. Relief organizations, for example, the Red Cross, the Green Cross, which is a smaller kind of mental health version of the Red Cross, if you will, the International Critical Stress Incident Foundation, a variety of those organizations on national and international scales, for example, don't work very much together. And as over the last few years they have, there's been a lot less us-them thinking and a lot more collective identity, cross-credentialing of different members, and a lot more dialogue between these organizations. And then as things have happened, their ability to do that collective work and ultimately to do right by the community members that they're positioned in has been exponentially better. The political partnerships, that relates then to those organizations, but also we can just simplify it to Republican versus Democrat. The context of a disaster or a trauma is not the time to work out political agendas. It's oftentimes actually a uniter. And we see this, for example, with different disciplines. A lot of times in day-to-day practice, if we look at, I'm thinking of a number of different examples, but let me just use the mental health example, because that's the one that I'm the most familiar with. We have psychology, and we have social work, and we have marriage and family therapy. We have counseling, we have psychiatry. there's a variety of different ways to be a mental health provider. And in the experience of graduate school, or medical school graduate training, it can be very easy to get siloed or discipled into a particular discipline where you perceive your own discipline as best. So if you're a psychologist, that's better than a marriage and family therapist or a social worker. Or if you're a marriage and family therapist, that's better, maybe because you think more systemically, or the social worker because they think ecosystemically or are so good at advocacy, the psychiatry because they understand the neurophysiology of patients' experiences so much better. And they're all right and they're all wrong because every one of them offers a unique and very essential component of the work that we do. And when we have the humility to know and to really embrace that and work collaboratively as teams and to go back to the drawing board after something has happened and to have these discussions, ultimately we learn that we're all right and we're all wrong in terms of our own respective training, and that the whole is truly more than the sum of the parts when we collaborate together. So as we put all of those pieces together, community resilience is truly systemic. And we need then to look at the ways that our economic resources certainly fit together, the ways that our organizational and subgroups within that community fit together. We need to look at what is occurring now and to get ready. We always talk to our own students and to our own communities, however that's defined, and I'm speaking for a lot of my colleagues, is that it's better to it's better to prepare than it is to repair. And the time to really bolster the community's resilience and to have these conversations is not in the context of a disaster, but in the context of nothing particularly is going on right now. So let's figure out what we can do and how we're going to work well together if and when, usually when, something does. I sure appreciate it. Thank you for having me.